Whether during foreplay or the main event, fingers can be incredibly pleasurable for a woman when used with proper technique and understanding. In fact, with the right approach and methodology, some women can reach powerful orgasms from fingers alone. Fingers possess unique advantages that make them superior tools for intimate pleasure. They can bend and flex, adjust pressure dynamically, change angles precisely, and scale progressively from one finger to 2 or 3. This makes them incredibly precise instruments that are far easier to control than anything straight and rigid. I'm Dr. Talia Monroe, urologist and men's health expert. Today, I'll guide you through a comprehensive, step-by-step approach that is both respectful and medically grounded. My goal is to show you how to use your hands so that the woman you're with feels completely safe, truly seen, and intensely pleasured. The foundation: consent and preparation. Before any intimate touch begins, there are two absolutely essential elements that cannot be overlooked: clear consent and proper preparation. Establishing clear consent. Communication is the cornerstone of any intimate encounter. Ask clearly and directly, "Do you want me to touch you here?" This isn't just about the initial permission. Keep communication channels open throughout the entire experience. Check in regularly, listen to both verbal and nonverbal cues, and remember that consent can be withdrawn at any moment. Preparing your tools. Your hands are precision instruments, and like any tool, they need proper preparation. Start by trimming your nails short and filing them completely smooth. Even the smallest rough edge can cause discomfort or microabrasions. Next, wash your hands thoroughly with soap and warm water, paying special attention to cleaning under your nails. This step is crucial for preventing infections and maintaining hygiene. Remove any rings or jewelry that could cause scratching or discomfort. If dryness is likely to be an issue, keep a high-quality, unscented water-based lubricant within easy reach. Clean hands prevent micro-scratches and significantly reduce infection risk, while proper lubrication prevents uncomfortable friction that can ruin the experience. Step 1. The art of warm-up and teasing. Arousal for many women is a comprehensive, full-body process rather than a simple on-off switch. This understanding is fundamental to creating truly satisfying intimate experiences. Begin your approach far away from the genital area. Start with passionate making out, allowing the connection to build naturally. Move to kissing the neck, exploring the sensitive collarbones, and caressing the inner arms with gentle strokes. Progress to stroking the lower back with firm yet tender movements. Trace the curves of her hips and explore the outer thighs with deliberate, slow touches. As you gradually approach the inner thighs, consciously slow down your movements even further. While she's still wearing clothing or underwear, press your palm gently over the vulva area and hold this pressure for several seconds before releasing completely. This creates anticipation and begins to direct blood flow to the area. Trace the edges of her underwear fabric with your fingertips, creating delicious tension. The goal throughout this phase is to create steady, playful waves of pressure that alternate between contact and release, allowing anticipation to build progressively. Remember, teasing is not merely filler time before the real action begins. Teasing is actually the fuel that powers everything that follows. It increases blood flow to the clitoris, labia, and vaginal entrance, which significantly amplifies sensation during later, more direct stimulation. Step 2. External touch, slow and gentle exploration. With her underwear still in place, begin by outlining the outer lips through the fabric using light, exploratory strokes. Continue this gentle exploration along the inner thighs, building anticipation and comfort. When she clearly indicates her readiness and gives permission for skin-to-skin contact, slide a single fingertip along the outer lips with feather-light pressure. Then, with the same gentle approach, explore the inner lips. Maintain slow, exploratory movements throughout this phase. Instead of going directly to the clitoris, circle around the hooded area rather than making direct contact with the tip initially. Most women find direct stimulation of the bare clitoral glands far too intense during the early stages of arousal. Think in terms of feather strokes first, progressing to light circles, and then gradually advancing to slightly firmer oval motions. Throughout this exploration, watch carefully for her responses, changes in breathing patterns, subtle hip movements, and small sounds of pleasure. These are your green lights telling you to continue and possibly intensify your current approach. Step 3. Developing rhythm around the clitoris. Every woman's sensitivity profile is completely unique, but research and experience show that most women prefer rhythmic, consistent patterns over random or unpredictable touches. Try implementing a gentle, around-the-clock circular motion just outside the clitoral hood. This provides stimulation without overwhelming sensitivity. Alternatively, experiment with vertical strokes that begin at the pubic mound and glide downward to the vaginal entrance before returning upward in a smooth motion. Side-to-side figure-8 patterns around the hood area can also be incredibly effective. Use 2 fingers together for broader surface contact if she responds well to more diffuse stimulation, or maintain a single fingertip approach for more focused, precise pressure if she prefers pinpoint accuracy. Communication remains crucial during this phase. Ask short, specific questions that help you calibrate your approach. Would you like this softer or firmer? Should I go faster or slower? Would higher or lower feel better? These questions show attentiveness and help you customize the experience perfectly for her preferences. Step 4. Understanding when and how to go inside. This is a critical transition that requires careful attention and patience. While wetness indicates arousal, it doesn't automatically mean she's ready for internal penetration. Always check in verbally. Do you want me inside you? If she says yes, add lubricant if needed. Never attempt insertion when there's insufficient natural lubrication. Start with just one well-lubricated finger, moving slowly and deliberately. Glide slowly into the vaginal entrance and pause just inside the opening. This pause allows her pelvic floor muscles time to relax and accommodate the new sensation. Rushing this step can cause tension and discomfort. Once inside, use a slow, come here motion directed toward the front wall of her vagina rather than fast in and out thrusting movements. Remember, fingers excel at providing varied angles and pressure, not necessarily speed. Explore gently within a small area, moving just a few millimeters up, down, left, and right to discover what feels best for her. If you notice her tensing up, withdraw slightly, encourage deep breathing together, and return to external touch until she's ready to try again. Step 5. Locating the anterior sweet zone. Approximately 1 to 2 inches inside the vagina, on the front wall toward her belly, you'll often find tissue that feels slightly spongier or more ridged than the surrounding area. This anterior zone, sometimes referred to as the G-spot area, often becomes more pronounced and sensitive as arousal increases. Curl your fingertip toward this area using a slow, deliberate come here motion. Begin with very light taps or short, gentle strokes, building pressure gradually and only if she specifically asks for it or if her body language clearly indicates she's leaning into the sensation. Many women prefer steady, repeatable rhythms over intense pressure or force. Consistency and patience often prove more effective than strength or aggressive movements. Keep your other hand completely free and available. Use it to hold her hip reassuringly, stroke her lower belly in soothing circles, or continue external clitoral stimulation with your thumb pad if she enjoys blended stimulation that combines internal and external pleasure. Step 6. Thoughtful scaling, 2 fingers, and coordination. If she expresses a desire for more fullness or deeper stimulation, partially withdraw your finger, twist it slightly to create more space, and slowly insert 2 well-lubricated fingers together. Maintain the curved finger position so your fingertips can keep consistent contact with the front vaginal wall. This positioning is crucial for continued G-spot stimulation. Now you can begin combining motions for maximum effect. Your inside fingers perform small come here movements or create tiny arc motions, while your thumb or other hand maintains a consistent, reliable pattern around the clitoral hood area. Remember that small movements often produce big results. The more aroused she becomes, the less dramatic motion you actually need to maintain intense pleasure. At higher arousal levels, pressure and consistency become the true stars of the experience, not speed or force. Step 7. Adjusting pressure and speed near climax. As her arousal builds toward climax, her physical cues will intensify noticeably. Her hips may press forward seeking more contact, her breathing will quicken significantly, sounds of pleasure will deepen, and her thighs may begin to tremble with building tension. When you discover a specific pace and pressure combination that her body is clearly responding to and riding, this becomes your golden formula. Do not change anything at this crucial moment. Hold your established pattern completely steady through to the finish. If she says right there or gives any similar direction, treat these words like a lighthouse beacon guiding you safely to shore. Stay exactly with whatever you're doing. Many potentially powerful climaxes fade away or disappear entirely when the stimulation pattern changes at the last critical second. Consistency during this final phase is absolutely essential. Step 8. Popular variations many women enjoy. Hood strokes. Create a V-shape with 2 fingers and gently slide the clitoral hood up and down without directly exposing the sensitive tip underneath. This provides intense, but buffered stimulation. Outer to inner wave pattern. Create long, flowing strokes that begin at the outer thighs, move inward to the inner thighs, continue to the labia, and then flow back outward. This pattern helps reset sensitivity levels and provides variety. Pressure hold technique. Place your broad, warm palm over the entire vulva area and apply gentle, steady pressure without movement. This technique proves very calming and grounding between intensity peaks. Angle shift method. Place a small pillow or cushion under her hips to change the angle of the anterior vaginal wall, making fingertip contact with the G-spot area easier and more direct. Step 9. Critical hygiene and comfort notes. Maintaining short, smooth nails, clean hands, and adequate lubrication prevents uncomfortable micro-tears and maintains the pleasurable experience. If you switch from any anal contact back to vulvar or vaginal touch, either change gloves completely or wash your hands thoroughly first to prevent bacterial transfer. If she experiences any burning sensation or sharp pain, stop immediately, add more lubricant, and return to gentler external touch. Sharp pain is always a clear no signal that something needs adjustment. Mild warmth or stretching sensations may be acceptable, but only if she explicitly confirms this is comfortable for her. Step 10. Communication and aftercare. Immediately following her climax, maintain steady contact but lighten your pressure significantly as her body naturally unwinds and sensitivity returns to normal levels. Many women deeply appreciate being held close, having their ribs or hair stroked gently, or receiving light massage on their thighs during this vulnerable post-climax period. Offer her water to help with rehydration. When she seems ready and relaxed, ask one thoughtful question. What did you like most about what we just shared? File her answer carefully. This becomes your personalized playbook for future encounters. Important truths most men never learn. Not every woman reaches climax from internal stimulation, and this is completely normal and healthy. Many women strongly prefer clitorally focused touch exclusively, while others enjoy combining internal and external stimulation. The only way to truly know her preferences is to watch her responses carefully, listen to her verbal and nonverbal communication, and ask questions when appropriate. The emotional atmosphere and tone matter tremendously in intimate encounters. When she feels completely safe, genuinely admired, and unhurried, her body responds by improving blood flow and natural lubrication, relaxing pelvic floor muscles, and allowing pleasure to build more easily and intensely. Your hands can become extraordinary instruments of pleasure when you use them with genuine patience, medical accuracy, and authentic care for her experience and well-being. For men who want to enhance their intimate performance naturally, there are research-backed supplements that can provide support. 2 that I recommend most frequently in my practice are organic watermelon extract, which is rich in the amino acid citrulline to support nitric oxide production and healthy circulation, and an advanced performance formula that combines ashwagandha, takadali, fenugreek, nettle, and citrulline to support multiple aspects of male performance, including erection quality, stamina, testosterone levels, and prostate health. If you found this comprehensive guide helpful, please subscribe to stay updated with more evidence-based content and share this video with someone who values real, respectful guidance for intimate relationships. Remember, every person is unique, and these techniques should always be adapted to individual preferences and comfort levels. Communication, consent, and mutual respect remain the foundation of all satisfying intimate experiences.